Good morning, good afternoon, or happy midday. We're just opening the room so that we can get everyone in, and then we'll get started in about a minute. So good morning, good afternoon, or good midday to you, wherever you're beaming in from across the country and beyond. My name is Dr. Samir Sinha, and you're here today now for our launch webinar related to the NIA's latest report called Addressing Dementia in Canada, Raising Awareness, Challenging Stigma, and Reducing our Risk. Just before we begin the webinar, I'd like to do a land acknowledgement. The NIA is based at Toronto Metropolitan University, which is in Toronto, which is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, the Mississaugas, and the Haudenosaunee that bound them to share the territory and to protect the land as well. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. So again, welcome to our webinar. I'm going to be introducing my colleagues, Claire Webster, Dr. Jane Rylett, and Adam Morrison after we start with a short presentation. But again, my name is Dr. Samir Sinha. I'm a geriatrician and clinician scientist, but also I'm the Director of Health Policy Research at the National Institute on Aging at Toronto Metropolitan University in Toronto. And so welcome to our webinar, and we'll get started. So first of all, I just want to share a little bit about what is dementia, because this is what we're going to be talking about during our webinar today. And dementia itself is an umbrella term which describes symptoms that impact brain function due to neurodegenerative and or vascular conditions. Dementia symptoms can include a decline in cognitive abilities, such as our memory, as well as changes in mood and behavior. And dementia symptoms can increasingly interfere with the ability to perform daily activities over time. And there are many different forms of dementia out there. The most common that you'll see from left to right are Alzheimer's disease, vascular dementia, frontal temporal dementia, Lewy body dementia, but then there are other dementias as well. And there's often situations where people might have more than one form of dementia, and that's what we call a mixed dementia presentation as well. So that just gives you a sense about these diseases that you might have heard. Often I get asked, well, is Alzheimer's the same thing as dementia? These are all forms of dementia as well. So how common is dementia? Well, right now, we associate dementia as a common disease associated with our older populations. And right now, as of 2023-24, about 6% of older Canadians have been diagnosed with dementia. So that's 6% out of approximately 8 million older Canadians have been diagnosed with dementia. But we know that because age is the greatest risk factor associated with dementia, as we go up in age categories between 60 to 70, 70 to 80, and then 80 and above, we can start seeing that the prevalence of dementia can increase to upwards of 19% in populations who are 85 and older. And right now, according to the Alzheimer's Society of Canada, from their projections, they believe that close to 772,000 Canadians may be living with dementia as of 2025, and this could increase to 1 million by 2030 and upwards of 1.7 million Canadians by 2050. And we have to appreciate that right now, there are many Canadians who may be living with the diagnosis. We believe at least 500,000 Canadians are currently living with the diagnosis, but there are many other Canadians who are living without a diagnosis as well. We also know that the demographics of those living with dementia is also going to change in the coming years as well. And that's representative of the fact that our population is not only aging, but we're also aging in many diverse different ways. And so we have to consider how that additionally makes the demographics of dementia and aging that much more unique and different. So when we think about how many Canadians are affected by dementia, as I said, about 6% of older Canadians have been diagnosed with dementia, but we have to remember that many people know people or have known people who have been affected by dementia. And according to a PHAC survey, 74% of Canadians reported that they knew someone who had or currently has dementia. And so, to try and help get a better sense of what's happening with dementia in Canada and how are we addressing this public health challenge, the NIA, with the support of the Slate Family Foundation, has been given funds and support to help create 3 annual reports that really help support our ability to address dementia in Canada. Our first year's report, what we're launching today, really focuses about improving public awareness of dementia, reducing the risk of dementia, and challenging the stigma associated with dementia among the general public. And you're going to hear a bit more about our findings in a few moments. We're now starting to work on our second year report, which is now going to then focus on supporting our healthcare systems and workforces to better respond to dementia. And our third report in 2027 will zoom in on the topic of supporting unpaid caregivers of people living with dementia and the development of more dementia-inclusive communities. So in our first report about addressing dementia in Canada, we really focused on the state of our public awareness as a country as it relates to dementia. What are the factors that can actually help reduce the risk of developing dementia? And then also the real important need to challenge the stigma associated with dementia as well. And what we did was to try and do this work was we looked at all the publicly available knowledge that we currently have related to these topics in Canada. And we also then did a detailed examination of past and current government strategic plans addressing dementia in Canada. And so what we found is when we looked at surveys that the Public Health Agency of Canada has conducted over recent years, there's good news. 74% of Canadians are highly or moderately knowledgeable about dementia. 79% recognize that dementia is not an inevitable part of aging, and 85% have recognized that there are ways to lower the risk of dementia. But as you can see, there are clearly still opportunities to improve and make sure that everybody is aware of the things, for example, they can do to lower their risk. And make sure that more people know that this is not an inevitable part of aging, and make sure that people have the knowledge and skills because so many Canadians have been affected and will be affected by dementia. In terms of when we think about how do we reduce dementia risk, we have to appreciate that, again, it's not an inevitable issue, but there are some factors that we can control, such as our increasing age, our genetics, and our sex at birth. And increasing age, for example, we know is the most substantial known risk factor, with 97% of people living with dementia in Canada being 65 years and older. But that doesn't mean that 97% of people 65 and older are living with dementia. As we showed before, it's about 6% of older Canadians. But because that age is one of those strongest risk factors, we know that as we get older, as we hit our 70s, our 80s, our 90s, there's a growing chance that we might be living with dementia. We also know that there is a gendered aspect to dementia as well, because nearly 2/3 of dementia cases in Canada were amongst females as well. And so we don't know all the reasons for that. There's some speculation that because women live longer, then they have a greater risk by just being older, that they have a greater chance of living with dementia. But there might be also specific facts that being female might put you at greater risk in some aspects as well. These are questions, for example, that you might want to ask our panelists during our Q&A session as well. So we also know, though, that while there are non-modifiable factors, there are actually many potentially modifiable factors as well that we can do to reduce our dementia risk. And this is where we've listed the 14 factors, for example, like reducing exposure to air pollution, being social, drinking, less alcohol or no alcohol, thinking about our health, maintaining a healthy weight, healthy blood pressure, not smoking, thinking about diabetes management. People often don't make these connections that our vision and hearing, which help bring sensory input to our brains, if those are negatively impacted, then that can actually affect our ability to stay mentally stimulated as well. And then we have to know the importance of things like our cholesterol levels, the importance of exercise, the importance of maintaining good mental health, and also protecting our brains with using things like head protection or helmets, for example, if we're riding a bike, for example, or doing other types of sports that might lead to head injuries. So again, these are all things that there's now really, really good evidence around to support us working on these. And where this has actually been published in a really nice way is in the Lancet. The Lancet has a commission on dementia, and they recently reported this past year that now they believe that 40% of global dementia cases can be theoretically prevented if all 14 risk factors were eliminated. And so these are potentially modifiable risk factors. And the good news is they can be addressed at any age. Some, for example, it's better if you address them early in life. Others, it's never too late to address them. And we also have to appreciate that while I say these are relatively simple things, we have to respect the fact that social determinants, people's level of income, access to housing, racism, these are all things that can access to resources and also our ability to deal with these risk factors as well. The other challenge is that when people hear the word dementia, there's often a lot of stigma that's associated with it. And stigma itself is the process of assigning differences and negative beliefs or stereotypes to a particular group. And the agreement that with those beliefs and the negative feelings associated with it, such as prejudice, which can lead to unfair actions and treatment, such as discrimination. So the idea that sometimes people hear that someone's living with dementia and they might start having opinions about that individual. Well, if they have dementia, they probably can't communicate with me. They're probably not able to be productive members of society, and therefore, why should we even bother supporting or interacting with them? That's an example of how bad stigma can get, especially around something that's not as well understood as it can be. And we know that challenging the stigma associated with dementia is something that we really need to focus on because in a recent PHAC survey, they found that at least 80% of Canadians agreed with these statements that people have negative assumptions about the abilities of those living with dementia. Individuals living with dementia need supervision in case of dangerous behaviors, and individuals living with dementia require others to make decisions. Yes, there may be points in people's dementia journeys where they may have challenges with their ability to do their day-to-day tasks. There may be a risk of behavioral issues, and they may need others to help them make decisions around their own care. But this is not an automatic when people get a diagnosis as well. So stigma around dementia is also compounded by ageism, and 68% of Canadians and older reported experiencing at least one form of everyday ageism in their lives. So again, when we also have negative views around aging and older people, and then you compound that with dementia, which predominantly exists amongst older people, then you can see how these things can feed on each other as well. So I mentioned to you that we also want to look at what is the Canadian government and what are our provincial and territorial governments doing to address dementia in Canada. And so this is where we actually embarked on doing a jurisdictional scan. So our federal government, Canada's inaugural, had an act that required it to actually develop Canada's first national dementia strategy. And this was first published in 2019, titled A Dementia Strategy for Canada, Together We Aspire. And it really stated three key goals, three key objectives. One is to prevent dementia. And number two is to advance therapies and find a cure. And number three was to improve the quality of life of people living with dementia and their caregivers. And some of the results of these initiatives have been helping to create awareness campaigns, but also to do some of the surveys that have lent some of the data that you've already seen earlier in this presentation as well. And specifically, when we talk about the three things that we want to look at in our inaugural report, we know around public awareness, there's constant attention to this throughout the strategy, trying to raise awareness around dementia in Canada, around dementia prevention. One of the primary objectives and 4 secondary objectives were focused on this issue. And then around eliminating stigma, there was one secondary objective in the National Dementia Strategy that really spoke to these 3 areas that we're focused on today. And again, there's been a number of things that the federal government has done. They've been required through the Act to publish annual reports stating what is actually happening, so providing updates on initiatives, research and data points related to these objectives. 82% has been invested across a number of initiatives like the Dementia Community Investment, the Dementia Strategic Fund, and the Enhanced Dementia Surveillance Initiative. And there was a multi-year national public education campaign from 2021 to 2024 with a focus on dementia risk and stigma as well. In terms of Canada's provincial and territorial governments, their strategic a number of them have created strategies and action plans. And so we want to go back 15 years to actually see what have our provinces and territories done as it relates to dementia. We found that 6 out of our 13 provinces and territories have actually developed dementia strategies and action plans of their own. And we've listed those provinces here. And we also noted that 11 out of our 13 provinces and territories have also created strategies dedicated to supporting older adults, what we're calling senior strategies in particular. What we found is when we actually looked at all these different strategies that exist across the dementia and senior strategies that we could find, we found that 10 jurisdictions included objectives related to raising public awareness, 8 looked specifically at reducing dementia risk, and 8 looked at challenging stigma. And as you can see, the challenge is this doesn't add up to 13, and not necessarily are all these actual prior strategies and action plans, are they still actually currently active? So when we think about what we're doing at a federal level, when we think at a provincial territorial level, we can see that we're not necessarily tackling these 3 important issues at a similar level across the country as well. And so when we looked at our Canada's strategic plans overall, we found that the federal government and nearly all of our provincial and territorial governments have at least identified dementia as a key issue. We found one province in Canada, Saskatchewan, where there's never been the development of a senior strategy or dementia strategy. And so it's been more challenging there to see what they're doing around these specific things. But again, what we see is at least the majority have identified dementia as a key issue. The National Dementia Strategy itself, from our view, requires further key performance metrics and more consistent reporting of incremental progress on objectives. And at the provincial and territorial level, there are significant gaps that we've noted in formal monitoring and reporting mechanisms as well. So in the report that we launched the other day, the NIA has come up with 3 recommendations in its first look at addressing dementia in Canada. And related to these 3 broad areas and topics, this is what we've come up with. We've said that all Canadian jurisdictions need to implement a dementia strategy, action plan, or framework to guide planning and ensure an integrated approach, especially given the fact that by 2050, maybe 1.7 million Canadians will be living with dementia. 1 million Canadians could be care partners to people living with dementia. And we already know that 74% of Canadians have been affected by dementia as well. We know that all Canadian jurisdictions need to expand their current public awareness initiatives. What we could clearly see through the data that we have so far is that there's still too many Canadians who are not aware of risk reduction opportunities, and many who still say they don't have the clear knowledge that they'd like to have around dementia. And governments of all levels should also implement standard metrics to measure and monitor their progress and publicly report on their progress. As we like to say at the NIA, you can't measure what you don't monitor. And so by having clear metrics so that we can say, what's our objective? How are we going to see if these things are having an impact? This is what we need to do. So again, I encourage you to go to our website and to take a look at our report. I believe my colleague Jen will put or has already put the links to our report in the chat. And so I encourage you all to take a look at this so that you can understand more broadly what were the things we found and the reasoning behind the recommendations that we've created. And part of our actions related to this are really wanting to say, what can the NIA do? What can the NIA and its partners do? And so with the support of the Slate Family Foundation, not only did we want to put out this report and these clear call to actions, but we also wanted to say, we need to work on improving public awareness. given that the federal government is no longer doing a national campaign, we've decided to work with our partners to pick that up and really try and emphasize the latest knowledge we have about reducing risk. And so I'm now going to stop sharing my screen so that my colleague can show you a commercial that we just launched through our Small Steps Big Difference.ca campaign as well. So we're going to put this together. And while we're actually putting this together, I encourage that if you have questions, please put them in the Q&A box that you'll see at the bottom. We'd love to see your questions so that we can ask them to our panelists. And right after this, I'm going to introduce our panelists as well.
I was terrified. I was angry.
We were like, this is forever going to change our life.
She's paying a handyman to put batteries in her remote for her.
She looked at me and said, I don't even know who you are.
Dementia itself is a progressive neurological condition. It's a disease that robs people of their independence.
My mom was a fierce, independent woman. And then it just got to the point where there was one too many times that she went missing.
She was my mom. She was my everything. She'd call me and have to tell me that my dad died. I would say, Ma, that happened like 25 years ago.
I thought it was going by so slowly. And now when I'm looking back, I feel like time went too fast. I lost my dad, but I didn't really lose my dad. But he's not all there with me.
My name is Dave Carpenter, and I have early onset dementia. You get this dramatic diagnosis of dementia, like you might as well, throw yourself off a cliff. Giving a diagnosis of dementia is one of the hardest things I have to do each and every day. The good news is that there's 14 simple things that we can actually do to really reduce or delay our chances of getting dementia by up to 45%.
This is great. I mean, I'm very surprised to hear about the hearing loss. That's very interesting for me.
It's really relieving to hear that there is research out there now to tell me what I need to do and what lifestyles I need to change.
Exercising, taking care of yourself, keep reading.
Smoking isn't just about lung cancer, it can be about dementia. Drinking can be about dementia, not just liver health.
These are relatively simple things that any of us can do that can make an enormous difference.
So we need them shared as wide as possible.
Know that if you do all of the right things, there's definitely a path now.
Take these 14 things into your doctor and say, I want these part of my conversation with you.
There is an incredible amount of hope. And so I urge everybody to go to the website, to smallstepsbigdifference.ca, and learn about what you can do to help prevent or delay dementia.
Perfect. So thank you. And again, I encourage all of you to go to our website, smallstepsbigdifference.ca, and you can, again, watch the video. You can share the video. There's also lots of other infographics and other things. And there's lots of resources from our partners, our incredible partners across the country. So please take a look at it, and we'll make sure there's a link to the website in the chat as well. So now I want to bring together my panelists here, and I'm going to introduce them one by one so that we can talk a little bit about the report that they were all expert reviewers of, and then we're going to open it up to you. So again, if you have any questions, please feel free to put them in the Q&A section, and we'll start getting to those in a few minutes. But without further ado, I want to introduce, first of all, Dr. Jane Rylett. Jane is a distinguished university professor at the University of Western Ontario and a scientist in translational neurosciences group at the Robarts Research Institute. She was appointed as the scientific director of CIHR's Institute of Aging in August 2019 and is an elected fellow of the Canadian Academy of Health Sciences. She's the past chair of the Department of Physiology and Pharmacology at Western University. Following her PhD in pharmacology, she trained in neurophysiology at University College London, England, and neurochemistry at the Max Planck Institute for Biophysical Chemistry in Germany. She was recruited to the University of Western Ontario as a Rubinoff Scholar in Geriatrics. And Dr. Rylett is a cellular and molecular neurobiologist studying the consequences of age-related changes in brain and neurodegenerative diseases, and recognized internationally for her contributions in the studies on cholinergic neurobiology and Alzheimer's disease. Research in her laboratory focuses on mechanisms recruiting chemical communication in the nervous system in health, normal aging, and disease, and the impact on cognitive function. I'm now going to introduce Adam Morrison. Adam is the Senior Director of Public Policy and Partnerships at the Alzheimer's Society of Ontario, where he supports a provincial federation of 26 local Alzheimer's societies in advocacy, education, and programming for people living with dementia and their care partners. He recently worked at the Provincial Geriatrics Leadership Ontario and as the Director of Policy and Planning. And he also has designed and implemented integrated care models and co-created policies with clinicians and older adults that improve the quality of health and social care for seniors in Ontario. He also previously worked in the Ontario Public Service in various ministries, including the Ministry of Health and Long-Term Care, where his team launched the province's dementia strategy in 2016. And Adam holds a Master's of Science from the London School of Economics and Political Science, and he's also a certified health executive with that designation from the Canadian College of Health Leaders. And last but not least, I introduce Claire Webster. Claire is a certified dementia care consultant and a certified professional consultant on aging and a conference speaker and educator in the field of caring for an individual with dementia. As a former care partner to her late mother who had Alzheimer's disease, Claire has lived experience on the impact of this illness has on a person living with dementia and the ripple effect on family members. Claire works in collaboration with the Division of Geriatric Medicine and the Faculty of Medicine and Health Sciences at McGill University, where she is the founder and ambassador of the McGill Dementia Education Program and McGill Cares, a webcast series designed to support family care partners. She's also the founder and president of Caregiver Crosswalk, a consulting firm that provides education and support services to help individuals navigate the journey of Alzheimer's disease and dementia-related illness. She's also one of the McGill senior co-editors of the Alzheimer's Disease International World Alzheimer's Reports for both 2021, Journey Through the Diagnosis of Dementia, and 2022, Post-Diagnostic Management and Support, a Prescription for Care. She's also a member of the Government of Canada's Ministerial Advisory Board on Dementia, as well as a member of the Canadian Institutes of Health Research, Dementia Research and Innovation Funders Alliance Steering Committee. In 2025, Claire was awarded the King Charles III Coronation Medal for her dedication to advancing dementia and education and support for caregivers. So you can see, everyone, I have an incredibly distinguished and supportive panel, all the right knowledge and skills, and I'm really grateful to my co-panelists here because they very much helped to look over our report and made sure that it would be written in a way that could actually help us spur really good evidence-based policy recommendations. So now that you know who our panelists are, I'm going to go in that order. Jane, I'm going to pick on you first. So you are the chair of our CIHR Institute on Aging Advisory board and also a fellow member of the Ministerial Advisory Board on Dementia, and you've dedicated your life to doing research in this space. And from your perspectives related to this report, how is Canada doing in terms of supporting research around dementia, especially as it relates to the topics of stigma and prevention and just raising awareness?
Yeah, thanks, Samir. Really important questions. And before I start, I'd just like to congratulate you and colleagues on producing this report. It really brings together all of the current information that's available so that readers can find internationally approved information in one place. And also looking forward to the next two versions of this really critical topic. So congratulations to you and colleagues on this. In terms of research, I think Canada does extremely well in terms of producing critical information that's needed to understand both how brains change with aging and then can lead to the type of pathology that occurs in Alzheimer's disease and other forms of dementia, as well as looking at some of the ways that this could be mitigated. So looking at modifiable risk factors. I think we've made several outstanding contributions in this area, although much, much more needs to be done. I think where a lot more work needs to be done is around stigma. And this is a point that you've raised and pointed out, that it's so important for public awareness, for everyone to be able to understand what it means to have dementia, what the consequences are for the individual, and also the consequences for caregivers, whether these are family and friend caregivers, or whether these are caregivers that have decided on a profession to be able to help people with dementia. So from the research standpoint, I think it's important to understand maybe how the best mechanisms can be found to be able to convey information and communicate information. It's a form of research, and really understanding how to be able to get to different communities, different social cultural communities, different socioeconomic communities, to be able to communicate messages effectively in a variety of languages in a large multicultural country like we have. To be able to lead to public education, and I know Claire can speak to this in a moment. I think the other areas are really around understanding mitigation of risk to acquiring the changes in brain that lead to dementia. And so you very nicely pointed out the 14 factors that can be important and impact whether someone can develop increased risk, but we don't know how those factors work together. We don't know who they work best in and how they can be strategized and synergized. So I think a lot of research needs to be done in that area. And I think Canadian researchers are really well poised to be able to do some of that work. We have outstanding researchers in the community, and I think are moving in those directions.
Thanks so much, Shane. No, and this is great to get your kind of your insights on terms of how we're doing. Certainly, there's a lot of great work going on, and Canada is certainly punching above its weight in terms of trying to answer these questions. And again, part of the goal is how do we take the findings from this research and translate into policy and actions and that. And so that's where I want to bring in Adam here, because I terrorized you a little bit when we worked together on developing the first dementia strategy for Ontario, and I'd love for you to put that hat on again, because that was one of the strategies that we took a look at or looking around in terms of saying how do we think about taking kind of these ideas and making them actions, and any reflections on what are the barriers and challenges to making good dementia related policies or strategies, and what further thinking we need to do related to our recommendations.
It wasn't a terror at all, Samir. Always a pleasure. And I'll echo what Jane said as well. Congratulations to you and the team on this report. Really exciting. And for me, I think everything in the way that it's laid out really takes us from the idea that things like raising awareness, challenging stigma, and reducing risk move from a nice to have to a need to have, right? This is something that is essential for people living with dementia, their care partners, and everyone across the country. So speaking from the Ontario perspective, I think there's a real challenge because awareness, we're not just talking about public awareness. I feel like, every time I speak to a group of political staff or MPPs, there's always someone who comes up afterwards, and it's very clear that there is a lack of awareness about dementia, what dementia actually is, that it's not something that we all just eventually get, that we don't all just eventually go into long-term care. So there's an awareness piece where we need to do more and we need to do better in the public, and that includes with elected officials, so they understand the magnitude of the challenge, the importance of addressing it as well, and so that's why I'm really interested I'm interested in all of the recommendations. I especially appreciate number one, which is for government to be taking action, that each jurisdiction each jurisdiction in Canada across the Federation needs to take action with a framework, with a strategy, with an approach. I would even add on to that from the perspective of the Alzheimer's Society of Ontario. We think it's time for an agency. Dementia is very complex. It's not something that we can sort out with even an excellent government strategy that lasts 3 to 5 years. It is a condition that, in Ontario affects close to 350,000 people right now, and that number is only going to increase between now and 2050 per the Alzheimer's Society of Canada. And so we actually think that part of what needs to happen in terms of a framework development in Ontario, and I believe in other provinces as well, is to create some infrastructure. So in Ontario, we have Cancer Care Ontario. It's an agency, it's part of Ontario Health, and they're mandated by government, funded by government, to do the planning, to set the standards, to be collecting data, to be reporting to government, to be providing advice to government on cancer. We think that there needs to be something like that is mandated by government, that doesn't have an end date like a lot of government strategies do. And I think there's a significant challenge there. I think with this report and a number of others that have come out in the past few months, I think there's some momentum, and that's where a lot of my interest is in yes, going for something as a strategy, but I think that results in the government creating an organization that is responsible for coordinating this work. As Jane said, on the research side, there are a lot of brilliant people across Canada who are doing this work in research. It's the same in terms of clinical practice, but those folks are not formally coordinated. There isn't kind of that regular attention to how we're doing, benchmarking, how we can improve on what we're doing. And I think there needs to be some infrastructure in provinces, and I'm speaking from the Ontario perspective, so that momentum can be sustained over time, whether it's around the actual clinical practice, how people are being supported across their journey with dementia, as well as raising awareness, right? Like public health campaigns really can't be something that we're going to do for a year or two and then say, all right, gold star, pat on the back. It also needs to be something that's going to be sustained if we're going to reduce numbers over time.
No, thank you again. And I think you really spoke to the importance of, there's been a lot of different government strategies and action plans that have been announced over the years. But one thing we found in our report is that many of them are no longer currently active. And it's hard to actually say, what did they accomplish? Because there rarely are reports saying, this is what we set out to do, and this is what we actually accomplished. And so your notions about saying, do we need to have something more substantial, something that's not time limited, and something that is accountable will be important, especially when we think about both people living with dementia, but people affected by dementia, such as caregivers. And this is where I want to bring Claire. In terms of the data that we were showing, looking about public awareness around dementia and stigma related to dementia, from your perspective as having been a caregiver, but also thinking about the work that you do in helping to give advice to caregivers and raise knowledge and awareness around dementia, what do you think the biggest barriers to providing that awareness and knowledge and support, say for caregivers, and is at the moment?
Well, first of all, I'll echo what my colleague said. Congratulations on this great report, and especially on your public awareness campaign about prevention. It is just so practical and easy to understand for lay people that are not in the medical community. So look, I've been working and living in this space for about 20 years now. And prior to becoming a caregiver to my mother in 2006, I knew absolutely nothing about dementia. I thought dementia was all about memory loss, and I had no idea about how it evolves and et cetera. And I was a caregiver for 10 years, and now I'm caring for a really good friend of mine who's only 62, who has Alzheimer's, and unfortunately the disease is progressing fast. And, I think that in addition to the lack of awareness and understanding about this disease, there is the ageism, which the report explained, right? So the families, the hundreds and hundreds of families that I work with over the years, if somebody's over the age of 80 and they go to a doctor and they're showing signs of memory decline or anything, it's really, well, this is normal, and, the doctor's not taking the time. And so, whether that's, from a Quebec issue, Canadian issue, or having worked on these world reports, there are a few major factors that stand out. So, many healthcare professionals, unfortunately, were also not educated. Like there's some family doctors that weren't educated. Not everybody, not the psychiatrist. A lot of people weren't educated. So oftentimes people are having a hard time accessing the support or the evaluations that they need. But they may sometimes not be faced with it. May be faced with a doctor that doesn't understand the disease. So then they get referred to a specialist, and that can take up to 18 months to 2 years. There's also, like as Jane mentioned, there's cultural differences, right? I mean, dementia is viewed as stigma among different cultural communities. So some cultural communities don't want to talk about it. People are, accessing the healthcare system is really difficult. Navigating the system, where to go for information, education, and so it's a very common aspect. People are not being provided the education that they need. This is a disease that is ever evolving, so you're constantly having to adapt. So what I appreciate, about the theme of this report is that, raising awareness about dementia, reducing stigma, and supporting caregivers is really not an option. It's a societal challenge that we're facing. And as I don't know if it was Adam who mentioned, but the governments will not be able to provide enough hours or enough care. So you really need to start empowering people, better educating. And so what we've done is, I've made it my mission to educate the medical students at the university level, because by educating the medical students at the university level, they will be better equipped to be able to help families navigate, educate, and get to the resources in the communities that they need.
Thank you, Claire. No, and this is it. And I think some of the questions that we've been getting, we've got a lot of great questions that are coming in. People are like, so, with these reports that have been out there where we talk about lack of accountability, people are like, what accountability are you putting around your reports and the work that the NIA is doing? These are great questions. So everybody who's a part of the Slate Dementia Initiative, we've actually committed ourselves to monitoring and measuring the impact, of our recommendations, but also the impact of how many people are viewing what we're doing. Are we reaching the intended targets? Are we actually shifting policy, which is our ultimate goal, but also how are we making sure that we're raising appropriate awareness amongst Canadians? And one, Patricia, for example, said, I hope that all the strategies and action plans include a strong focus on the impact of on caregivers. And certainly, that's why, Claire, you're part of this, and why we've been really trying to make sure that caregivers are also going to be front and center in our Year 3 report, but certainly a group that we're thinking about all throughout our report as well. So we've got some questions that are coming in here, and one of them is focusing on this gendered aspect of dementia. And so, Jane, I'm going to bring this to you because someone said, as you mentioned, research shows that women are disproportionately affected by dementia. What do we currently understand about some of the factors contributing to this, outside the fact that women live longer than men? Jane, did you want to give some of your thoughts on that?
Yeah, I could. It's an excellent question, and one that is been very perplexing for the research community to be able to find the right kind of answers to really be able to understand this. And the person that posed the question is quite right. I mean, part of this maybe does relate to the fact that women live longer than men in general. And certainly because age is one of the major, if not the major, risk factor for developing dementia, then certainly the longer life can play into this. There have been a lot of studies that have been done, a lot of clinical trials and research approaches to be able to look at whether there's a hormonal basis for this. So in fact, looking at postmenopausal women and whether hormonal replacement can have an impact. None of this seems to have really made a difference. And so the difference doesn't appear to be just something as straightforward as women having a different hormonal basis than men. There is something that is really becoming front and center right now and receiving a lot of attention. And women, of course, have 2 X chromosomes. And I think that it's becoming increasingly apparent that as women age, there may be actually a genetic basis that's linked to sex. And so there is some silencing of some of the X chromosome factors. And so this is being investigated. It's really, you know, fundamentally a very mechanistic type of question, but we may learn more, and we may learn more of how that happens, and then to be able to look for pharmacological or drug targets to be able to address this, or other ways to be able to change with other kind of modifiable risk factors. So again, back to the modifiable risk factors, so much we don't know about that, and how by changing aspects of how we live will lead to risk mitigation. And so we need to understand more how that relates to men and women. And I think that's an area that there's going to be a lot more research in. So not a satisfying answer from the perspective that there is an answer for this, but I think that there are answers in the negative data. We know it's not linked just to hormonal changes. We know it's not linked to the fact that just because women live longer, and of course that is a factor, but there are much more fundamental differences between men and women at the genetic level, and at how risk factors can intersect with that. So that's where the research is going, and hopefully, you know, in the coming years, we'll be able to understand that a little bit better and have ways of modifying that.
Perfect. Adam, I'm going to come to you now, because one of our attendees says Dr. Jane Philpott references the political determinants of health, and says are provincial territorial jurisdictions a drag on dissolving our Canadian stigma? Just kind of interesting in terms of thinking about I can't even say the word politicization, you know, of these things, and how do we, I guess, how do we kind of maybe use this? Any perspectives on that, especially as you're very much in the policy space and seeing kind of seeing some of this work from different angles?
Thanks, Samir. I appreciate the question, especially the framing in terms of the political determinants of health. I don't know that governments are a drag on dissolving stigma. I would like to think that they can be the major enablers of us addressing stigma, of us raising awareness, right? That this takes attention, it costs money, and it also takes time. So I think there are significant opportunities for government to be able to step in. We saw with Canada's national dementia strategy a lot of very good pilots that happened for a number of years, and some people are, you know, asking, is this work continuing? Is it not? What's going to be happening? In Ontario, the government has invested in has made significant investments and continues to do so in direct service care across the continuum of care, and I think that's really important. But the political will, to me, I think generating that political will is something that's quite important. Today, actually, even at the UN, there was maybe a little bit more political will. I don't know if you saw, but dementia has been added at the General Assembly to the political declaration on prevention and control of non-communicable diseases. The estimate is that across the world by 2040, dementia is going to be the third leading cause of death. If that's not the wake-up call that we've needed for a really long time, I don't know what is. I think that in terms of getting politicians interested and engaged, these kinds of conversations are very important. They have to keep happening. I also think that dementia is a great opportunity for tackling system transformation, where we can be spending money better. I think it's a great opportunity for doing things appropriately and making sure that people are receiving the care that they require, the care that they deserve. And so I do think it takes everyone in this webinar and many more people to be writing into their MPPs. At the Alzheimer's Society of Ontario, we have a monthly campaign, and people can sign up, and we educate people on one of the issues we're passionate about for the month, and you put your address in and your email, and it generates a letter you can edit and send to your MPP. Those kinds of things matter in generating political will, because politicians are talking to each other in caucus, when they're in the House, when they're working together on bills. I think that is required to happen, because the sheer magnitude of dementia in the numbers seems to not be making a big enough difference for us to have a concerted effort. So I do think it takes a lot of people who are regularly writing into their MPPs and getting involved that way, and with other advocacy campaigns as well.
Absolutely. And as you said, right, I think people say, like, is government getting in the way, or can government be helpful? I think you really spoke to how government can really be an enabler. And sometimes there's so many things happening in the world right now. It's like, what issue do you tackle first? Great to hear that the UN is now kind of recognizing dementia as a major, kind of non-communicable disease. Great to, but also, kind of, you've also identified that how we can actually help our politicians know what are the priorities. And I think by the NIA and others, producing good reports and, kind of evidence-informed recommendations, I think sometimes that can guide kind of the work that needs to be done. Already we have Alicia and others are like, how can we get more involved, in this work over the next few years? I'll make sure that Jen and team here put in how you can sign up for our newsletter, for example, be aware of what our partners are doing. So, for example, when the Alzheimer's Society of Ontario is doing an initiative, how you can get involved. We certainly are looking for a coalition of the willing, and that's actually how we found the folks who are in our campaign. There are folks who answered our call in the newsletter saying, we're looking for people with lived experience who want to tell their stories, and you'll be hearing more from them. So that's how you can get involved, and we'll make sure that you know how to sign up. People are asking, like, what can their organizations do to support people living with dementia, or families living with dementia, such as, their employees or others as well. And I think part of the goal is, creating materials and resources like these, and making sure that we get them distributed, and that, workplaces can be a great way, especially recognizing that 40% of people who are working, for example, are also providing unpaid care to family members and friends. But these are some of the things that I think we need to focus on, how we all have a role, and there's ways in which we can use our platforms to share good information as well. One thing that I want to bring up to the group, for example, is the Claire, one question that's come up around caregiving is saying, dementia caregivers are they at a higher risk of experiencing dementia themselves, or other health concerns? Can you talk a little bit more about why that might be? What do you know about that? Is that actually a real thing, or not?
Well, the one risk they can face is a burnout. And I myself had experienced tremendous burnout because, well, I mean, as women, more women are caregivers than men, and women tend to have what we call that superwoman personality, where, you're taking care of, oftentimes, like I was a sandwich generation that had 3 young children, had an employment in another field. My father had just passed away, caring for my mother. And, I was one of those people that said, I'm all good. I don't need any help, right? So I see a tremendous amount of burnout. And it's oftentimes because people only wait for a crisis to happen before they ask for help. Many times when people reach out to me, or people, you see them in the yards, because they've let themselves go too long, right? They're not educated. They don't understand oftentimes how to manage sometimes the challenging behaviors that are associated with the disease. For older people, caring for older people, as the disease evolves, it requires a lot of help with activities of daily living, assistance in dressing, feeding, bathing, and people are not prepared about this. They're not prepared that this is how the disease evolves. And so the lack of not understanding the disease, the lack of not knowing how to access, most people are dependent on public resources. Not everybody can afford private care. So they don't know how to access these resources, and they wait, right? And, like I hear oftentimes from families, we're not there yet. We're not there yet, right? So my advice is, like, you always want to be one step ahead of the disease at all times. If the person just receives a diagnosis, find out in your community. There's so many great not-for-profit organizations like Alzheimer's societies, or we have NOVA, or different multicultural organizations that are there that could and lend that support. But if you wait until you feel that burnout, it's too late. So I can't answer, probably Jane could answer the question about dementia, but I see tremendous amount of burnout, and not only in women. A lot of men reach out to me, and they too, because the men has that oftentimes that personality where they don't want to show their emotions. They don't want to demonstrate their emotions. So they swallow their tears, they swallow their emotions, and it could lead to other, other health issues like, cardiac issues, etc. So I see a lot of burnout, and I experienced it myself.
Absolutely. And Patricia here has said caregiver burnout is real, right? And so that certainly has resonated. We only have a few minutes left, and we've done pretty well answering just about 15 questions so far, and they keep coming in fast and furious. But I want to kind of get our panelists to weigh in a little bit on this, because I think one thing that's been coming through a number of questions is how do we, incorporate brain health promotion into existing care pathways? So people are noticing, like we've mentioned, high cholesterol, hypertension. How do you increase capacity to counsel patients and caregivers in primary care and settings to discuss the risks? And another person, for example, Andrea, noted that, I'm 60 years old and starting to see a new GP in the last few years. I wasn't asked about any of these risk factors. I wonder why these conversations aren't standard and ongoing. And she's like, I understand the workloads of GPs and limit, but how are you working to educate folks around these conversations? And I think people are just wanting to make sure that our system can be ready to make sure it's giving us the information. But what are effective ways in which, I'll ask each of you, kind of, what do you think are effective ways to make sure that we're making sure that this knowledge is better incorporated? Should it just be through someone's primary care provider, or does it need to be even broader than that? So Jane, I'll start with you, then go to Adam and Claire.
Okay, that absolutely wonderful question. And this is an important topic of conversation. I'm going to come back to a point that Claire made around educating medical students and trainees, and not just medical students, but the wider healthcare community. So nurse practitioners all across the healthcare delivery system on what this is. So your commercial, I think, is a wonderful place to start, but and then it has to go beyond that. There need to be pamphlets and posters in healthcare facilities and offices, and readily available on grocery store shelves, any place you can think where people are going to be, that they're going to be noticing information. And so this becomes just standard public knowledge. And so it's built into the curriculum, and it's of all the healthcare professionals and beyond, and in community groups and community centers. I will say that the fact that we're talking about prevention strategies and risk mitigation, modifiable risk factors, is a relatively new thing. Mm-hmm. So you showed that the 2024 Lancet Commission figure, this only started in 2017. There was a 2017, then a 2020, and now a 2024 version. And before 2017, there was not a lot of talk about this. That Lancet Commission really summarized a lot of information beautifully. So this is relatively new information, and so important that we're having this conversation now, and that we find strategies to be able to move it into the general public conversation.
Perfect. Adam, any other thoughts?
Yeah, just really quickly, I think building on what Jane said, it does need to be kind of an across sectors, across the continuum of care approach. And so I'm just going to flag community services like the Alzheimer Society. So regardless of where folks are in the country, there is a provincial Alzheimer Society that you can connect with, and they do provide a support, education, anti-stigma training, a whole bunch of initiatives, including information that's online, and also caregiver associations are really good with support specifically for care partners. There's the Ontario Caregiver Organization. I know there's Caregivers Nova Scotia. Someone wrote in about that. These are really good organizations to connect with. And I say that because we frequently hear from our clients that is the one-on-one contact that they have, not just internet research, that's really helpful in terms of working through questions that they have, getting more information.
And Claire, we're down to the wire. Any
Very
last thoughts?
easy. Yes, I think that you should bring your Small Steps, Big Difference campaign to all the elementary schools across the country because brain health education should start at the elementary school level. That's where it should begin.
Well said, because we always say that it's never too late and it's never too early to start thinking about our brain health. And Jane, as you said, we weren't really having these conversations in a real structured way, even a decade ago. So that's the good news. I mean, we're saying that there's hope, but there's a lot of work that we need to do. And that's why I'm thrilled that the panelists here are people who have helped us develop this first report, have helped really influence the work that we're doing and will continue to do so, and continue to make differences in their own ways, but also as part of this broader team. So I want to thank our panelists. I want to thank everyone who's been in the audience so far. We got through over 20 of your questions and really have been able to kind of focus on the importance of this. So we want to thank everyone who's attended today. You can get more information on the work we do at our NIA aging.ca website. And certainly do look up our campaigns, share the information, and do get involved. So thank you very much. And thanks again, everyone, for joining us today.